your wristband, please. And can you tell me your full name?
Meredith Fitzpatrick,
And your date of birth?
2495.
Okay, and do you have any allergies?
Yeah, I have an allergy to latex.
Okay, so we'll make sure to have latex-free gloves in here for you today and all latex-free products. I'm here to insert a urinary catheter. Have you ever had one before?
Yes, I have.
Okay, so you know they're a little bit uncomfortable, so we'll try to get through this as fast as possible. I'm going to lift up your bed a little bit.
Because then I'm going to put the next video of like I come in with this
Alright, and we're going to have to lift up your gown a little bit, so would you like me to drape you for the procedure?
No, that's okay.
I didn't like commit technically, but
I don't know. It's up to you. It's yours.
I'm going to lift up your gown.
okay, Yasmin. I don't want her to be like, you fucking
oh, maybe because this is lower than that.
I thought it better than I thought about it. I was thinking about it. So if not, then I have to do
Okay, we're going to put your legs in a frog-like position with your knees outward.
or have Yasmin watch it. Did you finish it?
What do you say?
No, come
Okay,
here.
so we're
Okay.
first going to start with perineal care. So right now I have some soap and water and some towels. I would be soaking my towel in some
Okay. Okay.
I would be cleaning on the outside from front to back and on the other side front to back and through the middle front to back while I'm rotating
Okay, so now I'm gonna do the second
my
thing.
towel.
So let me move all this stuff. Pretend like it's clean.
I would also pat dry the area, just perform perineal care, discarding my gloves. Rewash my
So she does have an allergy to latex and she's on two different medications. The first one is normal saline. She's being given 100 milliliters per hour and she's going to IV infusion. She's also being given Roxapine, 1 gram IV piggyback every 12 hours, and that's an antiviral. So for the general assessment, we did come in and check the perineal area to see if there was any breakdown. About breathing. Because I don't know if you want to hold this and breathe and record. So we continued with perineal care. So that she after that, we did so not recording it to make sure that the urine was fresh, and then we would send it on to the So for the recommendations, I just put it over to you, and then she has perineal care and catheter care every 8 hours or when needed. Also that she continues to take the medication to make sure that does pick up. And lastly, that her urine collection back.
Shiny side down. I'm just going to be laying this under your bottom, okay?
Put it down. You gotta set it.
Okay, I won't be needing these. And are you allergic to shellfish or iodine, Miss Patrick?
No.
Okay, I would be tearing open your packet. Throwing that away. Throwing that away. Alright, we're going to get started. So I'm going to be cleaning the area with iodine. I'm going to be going front to back and throwing it away. And on the other side, front to back and down through the middle.
Will there be a problem with my latex allergy?
Alright, now we're going to insert the catheter. Okay, Miss Fitzpatrick, take a couple deep breaths. Try to relax as much as possible. Okay, I'd be inserting until I see urine within the tubing. Once I do, I push a ½ inch more. And at this point, I can go ahead and grab. Hold this in place so I can insert 10 milliliters to fill up the balloon.
I don't know if you can understand that.
Okay. I'm gonna go ahead and pull until I feel resistance. And I would go ahead and lock this on the stat lock to the inner part of the leg. Once this was locked, I would go ahead and put this below the bladder and hang it below the bed. Okay, Miss Fitzpatrick, we're going to make sure that we leave this bag below your bladder. If you do need to get up, make sure you let me know. And you want to make sure that we get no kinks in the tubing, and you also do not want to sit on it, okay? So at this point, I would go ahead and take a urine sample. Go ahead and close this up and put this back. Okay, and then I would document on my MAR that I inserted the urinary catheter and also used 10 milliliters to inflate the balloon. I would also put the name, date, time, and room number, all the information on the urinary sample. I'm going to take out your catheter now. I'm going to go ahead and remove the fluid that was within the balloon. Okay, I noted how much fluid came back out into the syringe. We're going to go ahead and take it out. And I would go ahead and throw this away.
I'm insuring patient privacy. Come in the room. Hi, my name's Anna. I'm your nurse. Can you please confirm your name for me?
Yes, Merida Fitzpatrick,
Okay, and what's your date of birth?
2496.
Okay. Okay, Merida, do you have any allergies that I should be aware of?
Yes, I do. Latex.
Latex. Okay, so I'll make sure that everything I'm using today doesn't contain any latex in it, okay? So I see on your orders that we have an order for normal saline. That we're just giving you that to keep you hydrated, as well as we have an order for Rocephin, which is an antibiotic to treat your urinary tract infection.
Okay.
Some of the side effects of this drug, however, could be some nausea, some vomiting, as well as some diarrhea or some dizziness. With that being said, would you be interested in taking this drug
Yes.
to treat your infection?
Yes, please.
Yes. Okay. So I'm gonna go ahead and go get that, go get those medications for you, and I'll be back in a minute. Okay. So I'm going to get my drugs. And I'm checking against my MAR. I see here that I have 0.9% sodium chloride, which is normal saline. And I see that I have my antibiotic right here, which is Rocephin 1 gram. Okay, so I'm going to come back in the room and wash my hands again. Hi Merida, I brought back your medications. Before we get started, can you please confirm your name for me?
Yes, Merida Fitzpatrick,
Okay, and your date of birth?
2496.
Okay, and can you restate your allergies for me one more time?
Latex.
Latex? Okay, so the ghosts that I brought do not have any latex in them. So I'm going to go ahead and get your primary infusion of normal saline started, okay? I'm going to wash my hands again before I put on some clean gloves. Okay. So first I am just going to be priming the infusion of normal saline. So first I'm going to check that it's the right drug against my MAR. So I see that it's 0.9% sodium chloride, which is normal saline right here. I see that my bag's intact all around. I see that the fluid is clear all the way through. And I see that the expiration date has not passed. Okay, so next I'm just going to invert it, take the cap off. And now I'm going to be spiking the bag. Okay. And next I'm going to hang this up. And I'm going to make sure that all the lines are closed right now. So I'm going to open that and prime my tubing. Okay, I'm going to run it until all air bubbles are clear throughout the entire line. I still see some air bubbles coming through. You see that it's dripping right here, so we're going to go ahead and increase that to half the chamber. Okay, so by now, all of the bubbles have completely cleared. So I'm going to go ahead and walk this now. Okay, and now I'm going to go ahead and hook this up to my pump. I'm just going to hook this up to the pump. Sure that's in. I'm going to close this up. Okay, I'm going to turn my pump on. Okay, all my lines are closed right now, so it's not going to be going anywhere. So first we're going to get started.
I choked as soon as I heard it.
Sorry.
And I'm going to go ahead and open this up so it doesn't tell me that the lines are cleared. So I'm just going to confirm.
It's fine. I just want to get it.
Hello.
Okay, so now I'm going to be selecting the channel. And this is normal saline is going to be ran as a basic infusion at a rate of 100 milliliters per hour according to my MAR. So I'm checking that it's the right rate. So I'm pressing the rate, and that's 100 milliliters per hour. And the volume to be infused is the amount of fluid that's going to be injected into my patient. And I'm going to set this to 900 milliliters because there's 1,000 milliliters in my bag, and I'm going to want to set this at 900 milliliters. That way I know I have enough time to come back and replace the infusion before it's completely gone. So now I'm going to go ahead and get that started, running at a rate of 100 milliliters per hour.
Making adherence to the tubing and keeping hydrated. And the Rosafen is an antibiotic.
And you see that it's going to begin dripping.
Some side effects of Rosafen are a headache.
See, it's dripping through my line as well as through my chamber. Okay, now I'm going to, that's going to be running to my patient. Right there. And then next I am going to be running my big trap line, and I am going to be connecting this. And so I'm going to want to dice the same bag just how I did the first one. So I'm checking it's the right drug. Rosafen, 1 milligram, 1 gram of Rosafen, and this is the antibiotic to treat the urinary tract infection. So, and I see that the whole bag is intact. I see that the bag is clear throughout, and I see that the expiration date has not passed either. So I'm going to take this off. Actually, let me open my secondary set first. Okay. And I'm going to take off this. And I'm going to be spiking the bag the same way I did the first time. Okay. And again, my line is closed. And before I connect this to my primary infusion, I'm going to want to clean my port right here with an alcohol pad in order to prevent any further infection going directly into my patient's line. So I'm going to want to clean my port for 15 seconds in order to kill any bacteria that's present. So I'm going to just connect these two. And in order to back prime this, I'm going to open this valve. And if you'll see the bubbles come through here, that means that it is priming. So I'm going to want to raise it up now before it gets full. And I'll hang that here. And I'm going to connect the primary to here. So it's at a lower rate. That way we want our secondary line to run first. Okay, in order to program this, I'm going to want to channel select. I'm going to run it as a secondary line. And so now I can go through here and try to find the drug that we're infusing. And okay, let's page down. Okay, and here it is, ceftriaxone, and here it's on my MAR, 1 gram of that. And here it is, 1 gram, so it's going to run at a rate of 50 milliliters per hour. And this is the drug. Yes, and we're next going to confirm. And we're going to start that.
I'll be right back and go ahead and get the medication.
And so you see that the secondary line is running. Ceftriaxone.
My name is Ariel,
And that is 1 gram. And if you look here, you can see that this one is dripping. You can see that that is dripping through the line. And if you look at the normal saline, the primary infusion, you'll see that it is not running at all. See? Nothing is running. So whenever this bag is completely done, then the normal saline will just continue running on its own. Okay, and then that's all. And then I'll just reassess my patient to see if they're experiencing any side effects from the drug. And I will document on my MAR right after that I have administered both of those and the time. It is 18:35, so I'll document that, the time. I'll initial that, and then comments, we're just hydrating. And here with the antibiotic, again, same time, initial, and comments, this is for the UTI infection. And I'll just sign the bottom of my MAR, and that is it.
My name is Ashley. I was the student nurse taking care of 23-year-old female Merida Fitzpatrick today in room 228. Throughout her care, I inserted a urinary catheter. There were no complications with that. Normal saline at 100 milliliters per hour and Rocephin 1 gram at 50 milliliters per hour were administered through the patient's IV. She stated to me that she had a latex allergy. She remained alert and oriented throughout my time with her, and during period care, the skin integrity was intact and there were no abnormalities or concerns with that. After insertion of the urinary catheter, a urine sample was taken to confirm that she in fact had a urinary tract infection prior to insertion. Some of my recommendations would be to increase fluid intake, perform perineal care every shift and as needed, continue monitoring the patient for adverse effects for medication administration, and to monitor the IV site for any infiltration or inflammation.